Now let's see the antagonist. Antagonist is only blocker. They are blocking the area. Competitive antagonist and non-competitive antagonist. If we say this non-competitive antagonist, there is no competition. If we bind it with, it will not detach because affinity is very high. If we see this competitive, there is a competition or bond with something. Example: the pharmacological and physiological dues is it is comparatively more than a physiological. Pharmacological is comparatively more than physiological. Now, what is physiological dues? Physiological does only to replenish the body need. Example: it's only maintain the body calcium level, not increase it. But in pharmacology, is it modify the function. Two drugs are present: agonist and antagonist. Competition between these two, which thinks more, so it will be blind. Example: cortisol in our body has certain limit, but if we are taking glucocorticoid, then they are 25% more potent. If you see the pharmacology doses means more amount of dose. It always more than physiological dose related to medicine. Now, what is the competitive antagonist? Example is naloxone, naloxone, naloxone. It competes with opioids like morphine or heroin for the same binding site at mu, kappa, and delta opioid receptor. Non-competitive antagonist. Example is ketamine blocks the NMDA N-methyl D-aspartate receptor by binding to a site within the receptor channel, preventing the flow of ion through receptor, regardless of the amount of glutamate the receptor natural agonist present. Action associated. If we see this gamma amino butyric acid, GABA. Now, what is allosteric modulator? If you see this gamma amino butyric acid, GABA, allosteric modulator can also have the positive or negative. If something is decreasing, then modulator increase it. Agonist and antagonist are present on other side, but it influence ionic channel. Now, allosteric modulator. One agonist or antagonist will influence the main receptor. This is the GABA receptor. Inhibit impulse, inhibitory neurotransmitter, inhibit exciting. This GABA is the structure, and a man benzodiazepine positive modulator. It's not bind in the place of GABA. It bind parallel to man receptor, cause the Cl ion to more inside the cell. Okay, what's a hyperpolarized state? This can increase negative inside the cell. In hyperpolarized state, increase negativity inside the cell. We see the benzodiazepine influence the GABA, so more Cl will move into the cell. First, the negativity decrease, but when benzodiazepine influence GABA, more Cl move inside the cell. Point present parallel to receptor, but it is not the part of receptor, but it will influence the main receptor. Activate potential will come when we active achieve the present achieve the threshold potential. What it says this diagram is this polarized and repolarization and hyperpolarized state and depolarization. Let's see this. This is structure. Now, gamma cause movement of Cl ion into cell and lead to a more active inside cell and known as hyperpolarization. When we are deprived to sleep, then no movement of Cl ion inside the cell occur. If GABA receptor doesn't cause movement of chlorine ion from outside to inside, when we take benzodiazepine, then it's bound parallel to GABA receptor at another site, parallel to GABA receptor, and then it influences the GABA receptor to move chlorine ion into cell and more negative inside cell. So then we go to sleep after taking benzodiazepine. If we see GABA. Now, interaction. Interaction. If the presence of a drug, food, or herb modifies, alter the desires, alter presence of another drug, food, or herb is called as interaction. Interaction. If drug is present, we take nutrient. It modify its function, bind it, or interact with it. If we take nutrient, a drug is added and then do interaction. Types of interaction: drug interaction, drug food interaction, food drug interaction, drug nutrient interaction, nutrient drug interaction. If we see the drug interaction, presence of one drug will alter the presence of other drug. Same for all. Mechanism can be pharmacodynamic based mechanism or pharmacokinetic based mechanism. Either you have to take the drug before meal or after meal. Drug the take empty stomach. It is the simple heading. Drag the take an empty stomach. What's generic name? Class, use, interaction, reason. If we see this azithromycin, it's an antibiotic. Azithromycin capsules antibiotic. Food present that will decrease the absorption of this capsule 50%. Reason: food decrease the opening of hard capsule. That why drug absorption decrease 50%. If we see the second one, bisphosphonates, it's used for the osteoporosis. If we see this bisphosphonates, that's why we prefer to take empty stomach before 2 hours of meal. It's used for the osteoporosis, bone matrix, decrease calcium, phosphorus, bone density decreases. If we take dairy products such as complexes with forms absorption not occur. Dairy product interaction with this drug and chocolates makes like the milk, cheese, butter. Now this type of the bad. Some, Sometimes empty stomach check antibody, it causes bloating. So if we want to increase this absorption, check empty stomach but be bloating, beer bloating बर्दाश्त करते हैं ब्लीडिंग को. And number three is tetracyclines, silence, tetracyclines. It is very bad interaction with the dairy product or containing anything. Chelates form. They will deposit in teeth, permanent discoloration of teeth, and bluish discoloration of teeth. If we say that the dextroamphetamine, dextroamphetamine, it is the anus stimulant. It can be altered by acidic food like protein. This drug degrades in highly acidic environment like protein or spicy food. Acid increase to degradation occur. When passion acid increase to degradation occur. Degradation occur when a patient have stomach ulcer even by smelling the food acid release in the stomach. So absorption. Now number five is proton pump inhibitor. It induces the acidity of stomach or reduces the acidity of stomach. 20 to 30 minutes before meal when no secretion occur. If we can see this. Inhibitor and is this like omeprazole, zanoprazole, lansoprazole, desantoprazole, pantoprazole. Okay, cephalic or pregastric. It is related to senses. Only we think about the food, and smell the food, secretion occur stomach, saliva and water. Exhale release and pH decrease. Feed forward mechanism. If it's gastric phase, after eating food, secretion occur. If you see the post-gastric phase, when stomach, food motor intestine, secretion occur, pitch increase, acid present, also food present. After the eating, secretion. Now, rate is the per unit time. No, frequency. Force is intensity. Now, this drag number 6 is digoxin. Used in a cardiac failure, positive entropic effect, increase force of contraction. Absorption decrease when taken with food and peak plasma concentration decrease or delay. Drag in blood concentration increase, drug excreted by metabolism, and okay, peak plasma concentration of drug reaching blood and excretion is more absorption and excretion become equal. Now number seven is diltiazem. 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 Calcium channel blocker CCB used in high blood pressure, also used in heart failure and arrhythmia. Now, what's the diltiazem? Diltiazem, diltiazem, diltiazem. Its absorption decreases when we are checking on the food and in fasting condition. Its absorption increases because food close pyloric sphincter, and drag not reach to the intestine. If we are checking the food, so gastric emptiness will slow. Food is food is in stomach and drag also in stomach due to digestion. Drag also degrade and digest and dissolve in stomach. If not reaches to the intestine because the sphincter closed. Now, what is the primary hypertension? Primary hypertension is when we don't know the cause. Maybe vasoconstriction, maybe cholesterol, maybe RAAS deactive. Number two is secondary hypertension. In this we know the cause. This is something with adrenal gland and kidney problem. Oh, this is what's this condition is pherechromolitoma is a tumor in adrenal medulla producing epinephrine norepinephrine. This led to a cause of BP condition in which adrenal medulla producing producing epinephrine norepinephrine. This led to the cause of BP. Okay. We can cure secondary because we know the cause of tumor in adrenal glands, so we remove it. Important is the furosemide. It is the diuretics, kidney patient, HTN, increase the amount of urine. Furosemide in fasting state, more absorption occur. Reason same as dietazem. Okay, glipizide. What is the glipizide? This is anti-diabetic. Absorption will be increased if we take it before 30 minutes of meal and improvement in clinical impact is seen. What is the lexothyroxine? And this is a T3 and T4 when less hypothyroidism, we not have some sufficient quality of thyroid hormone. Before meal, we tax absorption increase of lexothyroxine. Number 11. Metronidazole, used in ulcer and anthelmintic like parasites, amoeba, food poisoning, and anthelmintic is flagell. Now, this is ultraviolet food present peak plasma concentration decrease between check after food with test impression practical check after but we take it before it causes a metabolic test. Now, postural hypotension or thoracic hypertension. Hypertension खड़े हो तो चक्कर आते हैं बीपी डिक्रीज होता है cardiac output stroke if BP is equal to cardiac output ضرب TPR cardiac output is equal to stroke volume ضرب heart rate stroke volume अच्छा cardiac output is stroke volume ضرب heart rate stroke volume of blood that is pumped by ventricle to aorta in one beat. Cardiac output is the ability of heart to do work in 1 minute. 12. Phenytoin. 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 It is the abnormal discharge of electrical impulse whenever you have more than one seizure associated with some comorbid state like anxiety, depression, memory loss, neurological and physiological disturbance, that is epilepsy. Okay, this phenytoin, this uses anti-epileptic. If seizure, convulsion, epilepsy, abnormal contraction and relaxation of muscle. If muscle exists in small quantity, they are called as jerks. आंगों का पड़कना. If we are not hydration and electrolyte unless, so jerks occur. It can alter body. Presence of food will alter the absorption because absorption intestines it should be taken before meal. Number 13. Number 13 is quinolones. It is the ciprofloxacin, Novidet, norfloxacin. Quinolones is ciprofloxacin, Novidet, norfloxacin. It is the antibiotic in this gelatinous form not only with calcium, also with iron and zinc. These drugs require acidic environment to absorb. If we check with antacids, so absorption decrease are a white zinc, iron, calcium supplement. Antacid is neutralized acid. Prefer taking before meal. Patched up Montelukast is anti-allergic. If blood volume increase, so venous return increase, so more blood more toward heart. So more blood more toward heart. So stroke volume increase. So cardiac output increase. So blood pressure increase. If versus this Vice versa, BP increase, CO also by GPR, CO is equal to increase in SV divided by HR due to cardiac increase to a treadmill output BP increase due to cardiac increase output BP increase. Now, next drug is warfarin. It is the anticoagulant. Food will alter the absorption. Number 15 is zephyroscost. It is anti-allergy. Food will decrease the absorption. 40% decrease absorption. International normalization ratio (TNR). If we okay, if we are checking anticoagulants, so INR should be checked. INR checked by the PAT test, prothrombin time test. Now let's read that. This ratio tells that how much a blood is thick or thin. Normal is if we see this normal blood 0.8 1.3 range. Who not take anticoagulant if person taking warfarin anti and anti normal is 2 to 3 range. जितनी कम मतलब ब्लड थिक जितनी ज़्यादा है तो 3 है. If increase then 5. So hemorrhage occur, bleeding, start, food present, delayed absorption. Now is day 16. Zolpidem सुकून देने वाली नींद और दवाई. It is sedative and hypnotic but is not a benzodiazepine. Sedative hypnotic. Food present delay the absorption of this drug. Food presence. Okay, this brain digestion absorption occur in stomach. Cooperate entire coating disparate deprive dissolve in intestine. Medication take with food after food. Drug. What is this? Medication take with food and after food. Drug. Amoxicillin, levulinic acid, or augmentin. Its class is antibiotic. If you take this combination without food, so it's cause bloating. So should be given with after food. If we take augmentin with food, then it absorption increase. Carbamazepine. Carbamazepine. It is the anti-epileptic drug. Food presence increase the absorption of drug because mostly it absorbed in stomach. Some portion absorbed in intestine. Carvedilol. Carvedilol. It is lol. Beta blocker. Class is beta blocker. Antihypertensive agent cause erythrostatic hypertension. In this we change posture and BP decrease posture hypertension. It can be use it with food that food increases absorption. If we see this Divaproax, antibiotic drug. It causes intestine upsets, stomach upset. So we should target food or after food to decrease stomach upset. Fenofibrate. It is the class of anti-hyperlipidemic, decrease cholesterol deposition, decrease cholesterol and normalize lipoprotein level and decrease blood cholesterol. It is used for the present. It is altered by present. A food will increase the viability of this drug because it dissolves in stomach. Fenofibrate. Now we can see this corticosteroid. It's number 6. Corticosteroid. It is steroid, anti-inflammatory, immunosuppressant. It decrease the synthesis of prostaglandin. That's why mucus lining thin, and this will be upset the intestine due to increase in acidity. That's why we prefer it with food. Dametalol, metoprolol. It's beta blocker, mainly antihypertensive agent. Food present increase the viability of drug. There is a level of acid and mucus production, so this level is maintained, then this is normal condition. But if acid increase and mucus membrane become thin, this is metformin, antidiabetic agent, PCOS, weight loss, cause intestine intest intestine upset, so we should target it after food. If we see this niacin, antihyperlipidemic, cause intestine upset, so it if we target the food, so the side upset will decrease. Is if we see this nitrofurantoin, it's antibiotic. Food present increase the viability of drug. If we see this NSAID, declotanic, ibuprofen, aspirin, sanazib. It is the anti-inflammatory analgesic pain-killing effect. Cause intestine upset due to decreased prostaglandin and mucus lining thin, so we take it with food. Potassium chloride NeOK hammer अगर इसको मुंह में रखे तो बहुत कड़वी होती है. Supplement this or sugarcoat it. It's very bad in taste. अगर IV से ले रहे तो अपनी पेन हो तो इतनी पेन होती तो बहुत पेन होती तो इतनी पेन तो बहुत. Food if we take it through IV cause severe pain, cause intestine upset, so take it with food. Okay, trazodone, trazodox, it and venlafaxine is 13 and 14. Antidepressant, food present increase the absorption, 20% absorption increase. Antidepressant, trazodox and venlafaxine. Number 15 is tamsulosin. Tamsulosin is prostaglandin increase in size, so uterus depressed, so no urination proper because urethra squeeze. Benign prostate hyperplasmic transmucin is Benign prostate hyperplasmia, increased nose cell after 60 year, 99% people have this. Food present increase the viability of that drug. Benign prostate hyperplasia, increase no number of cell. Effective food, fruit and drug therapy metabolism. Phase 1 metabolism. If you see this CYP3F4, it is 50% of metabolism. CYP3F5. Many processes go in phase 1. Oxidation, reduction, deamination, hydrolysis, etc. The most important one is oxidation. If this is grapefruit juice, these drugs altered by food and food statins, calcium channel blockers, statin, atorvastatin, atorvastatins, rosuvastatins, simvastatin, cholesterol lowering agent. Why they cause more pain? Because fibra no so no curcumin married fibronorcomerin interact with statin. This particular component interact with intestinal cytochrome enzyme inhibited it. When inhibited, it increased the concentration of drug. As concentration of drug increase, it causes side effect, increased muscle pain. If this is calcium channel blocker (CCB), diltiazem, amlodipine, verapamil, vera, verapamil. As previous, when the concentration of drug increase, it causes many side effects. One of them is increased arrhythmias. Case study: if squamous cell carcinoma. This is a type of cancer that arises from squamous cell which are thin flat cells found in outermost layer of skin, epidermis, and inliner of such organs as such as lungs, mouth, esophagus, and cervix. How squamous cell carcinoma develop? It develops when squamous cells undergo abnormal control growth, often due to factors like prolonged exposure to ultraviolet radiation, chronic irritation, or carcinogenic substance. It appears as persistent scalp patch ulcer or lump. It is left untreated may invade deeper tissue and spread and metastasize to other part of body. Squamous cell carcinoma is malignant tumor. This means it has the potential to invade nearby tissue and spread to other part of the body if remained untreated. She took dextrosol as chemotherapy. It's the anti-cancer drug. Why it is so? She has a recurrent infection when concentration of drug increase in body. It killed the cancer cell as well as normal WBC's neutrophil count decrease. It is the first line of defense. When she sees grapefruit juice for 2 weeks, the concentration of drag decrease in body, which is previous 65% after seizing it, it reaches to 60% decrease, almost 5%. What's the reason? Because the enzyme that is metabolizing it now not inhibited more. Cause cascade immature arterial fibrillation. It is actually a type of activity with how to beat more fast. Amiodarone, amio, amiodarone, anti-arrhythmic drug. Cytocom. It is a fantag. Palpation. Palpation. Irregular heartbeat. She fuses cytocom and palpation because of grapefruit juice. When she is seizing her from taking this juice, she get fine. Now it's orange juice. Anti-gut. Colchicine. component is furanocoumarine. Furanocoumarine. Orange juice interact with this degree increased drug concentration body and cause multiple organ damage. That's why stoppage of this drug is required for particular reaction. If you see the pomegranate juice, anti-epileptic, carbamazepine, and midazolam. What is midazolam? Used to produce sleepiness or dryness and relieve anxiety before surgery to certain procedure. When used before surgery, the patient will not remember some of the detail about the procedure. In which particular class midazolam lie? As a question, in which particular class midazolam lie? Common brand name is Sazolam. Vessel. Common generic name is midazolam. Midazolam HCl drug class is anticoagulant, anticonvulsant, antizoletic, benzodiazepine. Its availability is prescription only controlled substances. How it's used: liquid that is injected into blood vessel and muscle. Liquid that is swallowed. Uses: make you relax and make you sleep before a surgery and medical procedure. Certain type of seizure disorder is like an epilepsy. How does it work? Produce a calming effect on the brain and nerves which help to promote relaxation for surgery and medical procedure. Treat seizure. How is it supplied? The said form. Midazolam. Midazolam is available as 2 mg per ml oral solid in injectable form. Injectable form side effect. What side effects? Sleepiness, headache, feeling agitated, fever. Injectable form. Pan swelling, if this is injectable fluid. Pan swelling, redness, muscle stiffness near the injection. Injectable form. Effect, anesthetic sedation, cardiovascular toxicity. Counseling says the food use to reduce the effect. What's tomato juice? Yes, another one. Component is lycopene. Lycopene effect understudy. Lycopene may increase or decrease the effect of drug. For example, lycopene may increase or decrease the effect of proton pump inhibitor. Says the food are used to get desired effect. Lycopene effect. Green tea component. Lycopene drug understudy. Lycopene may increase or decrease the effect of drug. For example, lycopene may increase or decreases the effect of proton pump inhibitors. Since the food and juice to get desired effect. Green tea component add HN drug immunosuppressant. It's used for the Tacrolimus. Catechin interact with Tacrolimus, the immune suppressant drug used in the same type of organ transplant after organ transplantation to suppress the immunity so that no type of immune reaction take place. After this reaction, concentration of drug increase, immunity increase, immunity decrease. So how to seize the food? How to seize the food? Now, excretion, food that alter excretion, drug which excrete and food which excrete out from body. Food that altered. Two principles through which drug excrete out. Dependent. Number one is acid or alkaline environment of urine, and number two is reabsorption of iron and drug. We have a buffer system in our body. Many type of buffer, mainly bicarbonate buffer system, ammonia buffer system, phosphate buffer system. Point. Urination can be acidic and can be alkaline. Normally we maintain it, but sometimes we don't maintain. Due to we eat something and urine became acidic, maintain urine formation, but we can change the pH of urine. Can be acidic, can be alkaline. Although this is a buffer system, biased urine pH can be acidic, alkaline due to our food, mainly bicarbonate buffer system. This system maintains a urine, but still its environment can be acidic and alkaline. Now, drug may be also weak acid or weak base or less commonly neutral. Weak acid more absorbed in stomach, weak basic more absorbed in small intestine. E.g. aspirin is the weak acid absorbed in stomach like acetylcyclic acid. Most fact is H is H positive plus H negative is weak acid and A is N negative anion. Double side reaction weak acid not completely dislocate charges that work and cross the membrane. Charge cannot pass through membrane. Is weak acid no completely dislocate. It's a short acid, so it will completely dislocate. Weak acid converted to proton and anion. Neutral Neutral can be absorbed. Absorption occur in abuse. Weak acidic environment starving. Absorption. Weak basic environment solid. For excretion, double base track. How HCl make alkaline environment, acid environment. Partial cells secrete HCl and stomach. Which the partial cells secrete HCl and stomach. So that H2 plus CO2 is H2CO3 carbonic acid. In H2CO3, the H2CO with H plus proton bicarbonate, H plus HCl. H2 and CO2 converted to carbonic acid and it dislocated in bicarbonate and proton. H2 and CO2 converted to carbonic acid and dislocated in bicarbonate and proton. This proton, with the help of proton pump, move into the lumen. Now, proton H plus more into lumen and not more inside and H positive more into lumen with the help of proton pump inhibitor. From the lumen, NaCl more inside the partial cell. Proton H positive more into lumen and not more inside and H positive more into lumen with the help of proton pump inhibitor. This proton pump will carry Na inside and H positive proton outside. HCl is not released in the form of HCl. If it releases the cell damage, HCl releases in the form of proton H positive and chloride Cl. In proximal cannulated tube, 65% of sodium and it's reabsorbed. Now we have a chloride channel on both sides. One is lumen side, who is facing a lumen, and other is basolateral side, which is at backward and on the lateral side. This channel pick chloride from the blood and it will come into lumen. Now in lumen, H positive Cl are present. Now they combine to form HCl. Cl enter from the basolateral side and eliminate from luminary side. In our lumen, we have proton H positive. We are taking a weak acid drag and it is dislocated, so it means protons are increasing. If it's the weak acid is backward movement, H as if this was H positive plus A negative is product reacted product. Okay, H positive. If product quantity increase, it moves backward. product quantity increase, so it's more backward. So it if it's more backward, if we have weak acid and on weak acid no charge is present, it is neutral. If anything have no charge, neutral, and its size is small, so it can be absorbed in blood. This process is called as Morse effect. Morse increase and movement backward. It absorbs its charge because backward movement it is in intestine, so the positive and negative charge form, so they cannot be absorbed. If we say the neutral or absorbed charge not absorbed easily if channel not present. Absorption weak acid and weak base, stormy acid environment, small intestine alkaline environment. Excretion we say the weak acid drag, alkaline environment, weak base drag is acidic environment. Weak acid drag is for the alkaline environment, and weak base drag is acidic environment. Suppose we have a weak acid drag which is absorbed and ultimately that has to be excreted from the body. So at the lumen side, acidic environment occur in nephron. Weak acid again dislocated but intestine not in stomach because in acid environment proton ज़्यादा है. So weak acid weak acid and acidic environment, so drug will be reabsorbed. It will not excrete. But if we are taking weak acid and your urination is alkaline, so it will be excreted out. Food that promote acidic urination: meat. Increasing the acidic environment. Basic mechanism in which acid urination is promoted is unknown. But we know if we take meat, it will increase acid urination. And if we are taking weak acids, it excretion decrease. Now you see this fish increasing acidic urination, but egg mechanism is unknown. Food that promote alkalinicity is milk, citrus fruit. Basic thing related to mechanism that is buffer system counter through which either acidic environment or alkaline environment. Mechanism how these are producing acidic and basic environment is unknown. Reabsorption of iron and drug. We have different transporter. Patch stop. Drug also in the body already transporter. Okay, if a drug want to absorb, we have transporter. Sometimes they are specific for some drug, but sometimes from the transporter and trail are a particular drug transport. Like we have sodium channel that now will transport sodium and reabsorb it now. Now if you check lithium, lithium is drug that used in a bipolar disease, a type of depression and a type of chronic depression. In this, we show difference in behavior. If someone is laughing and suddenly starts crying without reason, in this situation, a time is persistent. Lithium reabsorption also occurs through sodium channel, but why add sodium? But L add sodium reabsorb होगा. बट ये तो सोडियम reabsorb होगा. ये या तो सोडियम लिथियम reabsorption occurs through sodium channel, but या तो सोडियम reabsorb होगा या फिर लिथियम. Lithium reabsorption also occurs through sodium channel, but okay. Now is this diagram, sodium channel diagram. Like in proximal convoluted tube, 65% of sodium reabsorbed. On the right side, a transporter have a transport mechanism that how much maximum it transports. So sodium transport maximum is very high. Many of the sodium is reabsorbed. बहुत ज़्यादा. What's the condition? Sodium quantity body increase, so we have no need to have an absorption of Na. So if we take lithium, so it will be reabsorbed. Sodium increase in body, so lithium absorbed. In this dimension, so no need to reabsorb. Transporter is free, that's why. If in body sodium quantity is less, if in body sodium quantity is less, so sodium reabsorbed and lithium will not, because it wants only one ion and molecule thing can absorb through this channel. So it means whenever you are taking lithium, so need to take less sodium. We want to excrete out lithium, not to reabsorb the lithium, because it is accumulated in body echo. लिथियम ने जितना काम देना था दे दिया. Now we need to excrete out, otherwise it build up in body. Body homeostasis. Sodium going to increase and excretion increase and reabsorption decrease. Sodium going to decrease, so excretion decrease, reabsorption decrease. This is natural health product interaction with drug. Effusions of garlic interact with warfarin and NSAID. Warfarin is anticoagulant and NSAID is antiplatelet. Ticlopidine, it is the antiplatelet. Dipyridamole, dipyridamole is antiplatelet. In short, there is anticoagulant and all of these are antiplatelet. Patched up. Garlic show interaction with anticoagulant and antiplatelet. Antiplatelet and also interaction with antiviral drug. Also, basically, they thin the blood, and now thinning activity will not increase occur, will not decrease occur. Now, antiplatelet activity or anticoagulant activity reduced due to garlic. Antiplatelet, they increase blood, but garlic inhibit it. They thin the blood, but the garlic inhibit it. They thin the blood, but the garlic inhibit it. Antiviral drug is protease inhibitor, and garlic is metabolized by the CYP3A4, and also protease metabolize CYP3A4. So garlic, protease and antiviral drug are interacting. Garlic एक वक्त में एक चीज़ मेटाबोलाइज हो गया, garlic या फिर protease inhibitor. Now we use anticoagulant. Anticoagulant. In minor cut, coagulation occur. Major cut, no coagulation occur. No coagulation occur. Major cut, bleeding non-stop because of the surface area is large. If we see as the diagram is a cut is very beneath this nerve. Blood is released. Blood is released when blood vessel rupture. So in minor cut, usually damage occurs at superficial layers, so blood is not released. Plasma serum, page 30 to 34 is skipped. Now we will again write or read this. Now it is 34. Plasma serum, how will we extract it? This plasma is the portion of blood that contains fibrinogen, serum fibrinogen. Both serum and plasma are fluid part of blood. Serum and fluid are fluid part of blood. Serum do not has a fibrinogen. In serum, fibrinogen is converted into fibrin. Serum do not has fiber. Serum do not has a fibrinogen, and in serum, fibrinogen is converted into fibrin. Serum is equal to plasma and fibrinogen because it is converted into fibrin. Blood interacts with glass furnace that activates clotting factor. Serum. If we see the serum SC 8 ml, blood is plasma RPM is 3010 to 15 minutes. Plasma due to in this the plasma due to anticoagulant fibrinogen is not converting into fibrin. Now the serum. But if we don't add anticoagulant in tube, then fibrinogen is converting into fibrin. What is cyanide purpura? Formation of clots on the head of old age, and they look like blue color, purplish color due to blood accumulation. What's idiopathic thrombocytopenia purpura? Its low level of platelets cause the formation of blood clot in the blood vessel due to blood accumulation and lead to a bluish or purplish color. Blood also contains anticoagulants such as hepacin or protein C, and also our endothelial layer is smooth, and to activate the clotting factor we require a rough surface. That's why no blood coagulation occurs, whether there's fibrinogen is present in the blood. Chromium, how it interact with calcium carbonate and antacid. Chromium Checking interact with calcium key carbonate is NaCl, only neutralize excess acid. Chromium absorbs in acid environment, so when we check it with calcium carbonate and antacid, they are absorbed doesn't occur. Pet stop. Spiramide is the furosemide is the spirolactose is K-spacing effects or the Caspering effect and a plus K excrete. It is antacid MgOH and OH. MgOH is diarrhea and OH is constipated. Okay, now it's ginger. Ginger interact with antidiabetic and antiplatelet activity. Ginger itself causes platelet dysfunction. Antidiabetic and antiplatelet activity ginger itself cause platelet dysfunction. So antidiabetic medication don't work properly if you tackle the ginger. If it's a licorice, Licorice interacts with guarding glycosides such as digoxin and corticosteroid and thiazide diuretics and spironolactone. Lactore, hallucin, a diuretic. Spinolactone is the Casparic effect, can reabsorb release and excretion. Patchtop is plasma permanent plasma with blood. No, this is meaningless. Is like rice promotes the excretion of potassium K plus with digoxin and with diuretic. It causes sodium retention. Like rice, it blocks the channel in kidney and any other channel of K plus and Na plus or furosemide plus spironolactone. It releases with water with sodium. Furosemide it releases with water with Na. Spiro, spiro, spironolactone. Spironolactone it releases sodium only and increases the absorption of K plus antacid and GOH2 used in diarrhea, KALHO used in constipation. Ginseng, brand or stimulant activity. It contains antioxidant activity. It interacts with anticoagulant and alcohol. It interacts with anticoagulant by increasing iron or blood thin and also interact with alcohol. Anticoagulant also increase iron and ginseng also increase iron so blood became more thin. It increases alcohol clearance from body plasma means kidney plasma amount and check Kogi. Mahawan. Mahawan Chinese have used in many medical medicine. It interacts with anesthetics, cardiac glycosides such as digoxin, methotrexate, bronchodilator, monoamine oxidase inhibitor, MON. These medications affect potassium by using imagine. But toxicity will increase if we take monoamine oxidase inhibitor because monoamine are very much important in brain. Monoamine, dopamine, epinephrine, norepinephrine, serotonin. These three are also known as catecholamines. Dopamine, epinephrine, norepinephrine, and serotonin are also called as catecholamines. Dopamine is the epinephrine plus norepinephrine is serotonin. These contain only one amine group. That's why called as monomers. Monoamines. That's why it's called monoamine. Depression occurs due to the deficiency of these monoamines that is called as monoamine hypothesis of depression. Deficiency occurs due to monoamine oxidase because it degrades and metabolize them in sympathetic cleft. So uses monoamine oxidase inhibitor that reduce the level of monoamine oxidase and increase the concentration of dopamine, epinephrine, norepinephrine, serotonin. MOA. Mode of action. Release more in blood due to stress. MOA. Release more in blood due to stress. If we say this inside reuptake and excretion, as you say, if we see neurotransmitter other to reuptake or excretion out, example, acetylcholine is metabolized into acetate and choline is reuptaken by neurons and acetate is excreted out from body. Now, with this excretion and reuptake, MOL increase the metabolism of neurotransmitters such as monoamine and cause its deficiency in blood body that's lead towards stress because they become less available to body due to metabolism by MOA. The patch type is serotonin syndrome and serotonin is high in body and due to using MEHAG and MOAIs serotonin level increase. Now in this is MEHAG toxic occur due to increase in serotonin level in body and this is known as serotonin syndrome that's called irritability and disorientation, high blood pressure. Now what is this? It's vitamin drug interaction. Vitamin drug interaction. If we see mineral vitamins source drug and effect. Number one is folic acid. It's beans, clear etc. Color, this is available in the video, so set a video. Now what is test defect? Test defect example: corona happened, you lost test, you don't sense thing. These are some medicine that alter test even you don't drink water. Now we are starting from the 40 ad. Gestation mean gestation mean gestation means perception of taste. Different taste example: bitter, sweet, salty. Maybe sour, pasteurized, legal taste. Now we see the structure of this tongue. Below the palatine tonsil is on this side of this. Lingual tonsil is on the north side of where this practice. Adrenal in nose, tubal between ear and nose, a tube. This is the three present. This is the interior tongue. Interior tongue is we see the sour and left side salty and another is sweet on the right front. 2 by 3. 1 by 3 is what's tonsil? The act as first defense. Tonsil act as a first defense. It's a lingual test. Study. Lymphoid organ. Two-man. WBCs, B cell and T cell. They are present where WBC is present and invading organ key them. Lymphoid organ. Thymus, tonsil, lymph nodes. Lymphoid organs are thymus, tonsil, and lymph nodes. Lymphoid organs: B lymphocyte, T lymphocyte. Now, they kill microbes and prevent from infection. Inflammation of tonsil is tonsillitis. Inflammation of tonsil is tonsillitis, and inflammation of tonsil is tonsillitis. Tonsillitis. What is tubal tonsil? Present between ear and nose. A tube present called Eustachian tube. Eustachian tube. Adenoid, tubal, palatine, linear. This is a eustachian tube present between ear and nose. A tube present called Eustachian tube. Tubal tonsil çekiminde present between ear and nose. Ear and nose udukta eustachian tube haviyay tonsil. Tubal tonsil. They make a ring called a Weldon ring. Weldon ring. Surface of the tongue is rough. These are some papillae is present at tongue. Molecule interact with papillae. They are basically taste buds. They are basically taste buds. We can see that is in a holiday farm. This is taste bud. Now is a big structure of the tongue. If this tongue is if circulating papillae, huh? When we are eating something, there is a particular molecule present in it that interact with papillae, and nerves are present that send signal to brain, and brain detect taste as sweet, salty, sour, etc. Taste disorder. We use word Gavsia for taste perception. Between we Nightful taste, it is ageusia. Means ageusia is nerve perception of taste. It is lost when we don't feel what we eat. Example in corona. What is hypogeusia? Less taste perception. Dysgeusia. Altered taste perception. खा कुछ रहे हैं, फील कुछ हो रहा है. सोचने से मेमोरी शार्प होगी. Okay. Phantogeusia. Physiological altered taste perception. It is also altered taste perception, but it is linked with brain. है नहीं, but the brain कह रहा है कि है. Like hallucination. We feel taste, but we are not eating. It is not a high ceiling neurotics or neurotics. See this. Now is the drug, class, and task defect. Acetazolamide. Acetazolamide is class is diuretic, used in heart failure, mountain sickness, high altitude पे जाके चक्कर आते हैं. Test defect is DSH, so test dysexia, dysexuic, dysexuic condition and feel like acidic test. Deficiency of oxygen and level of tissue. Hypoxia, deficiency of oxygen and blood level. Ischemia, do not go to an head. Type of hypoxia. hypoxic, hypoxia, किसी ने गला दबा दी या खाना फंस गया. Hypoxia, no oxygen at blood level lead to deficiency of oxygen in tissue due to some blockage or choking. Number two is anemic hypoxia, Hb deficiency. Number three is stagnant hypoxia. If your blood is stuck and not reaching to the particle side. Okay. Histotoxic, histotoxic hypoxia. You have an oxygen in blood. Your oxygen goes to tissue, but tissue not utilize it. It's called histotoxic hypoxia. You have an oxygen in blood and you have oxygen goes to tissue, but tissue utilize it. hypoxia. खाना खाएं या खाना पहुंच नहीं पा रहा. एनीमिक hypoxia. खाना आ गया लेकिन अंदर खाली है. स्टैग्नेंट hypoxia. बहुत स्लो है, कब से उगाया है बट जाए. हिस्टोटॉक्सिक hypoxia. आ गया है, खरीद लिया है मगर हाथ नहीं है खाने के लिए. There's a second reason is cyanide poisoning, etc. In low step, you utilize oxygen to produce, and that's gas cyanide ATP attached to cell. Abnormal motion sickness, mountain sickness, or stimulation of nerve system. Lack of vitamin B12 in the body, or stimulation of ear. 10 needs 10 it is can't begin to your dog. 10 it is 10 it is most positive cooperatively is 020202. Full saturation is 100%. If we remove so 75%, 25% is exhaled. Positive cooperatively. One RBC contains 250 million molecules. If no oxygen molecule is present, one molecule attachment is difficult. It is called TANSTAT. For next, it is easy to attach. This is called relaxed stat. If one molecule removed, then saturation is 75%. One molecule come and cause relaxation for other. It is called positive cooperativity. The lost molecule due to come out means 25% saturation is always present. The remaining oxygen is always stored if we do some exercise. Now it's drug class and test defects. Albuterol class is beta-2 antagonist. Test defect is D. In some person it causes metabolic test present in inhaler. Shattered term beta-2 agonist SABA. They are short-acting. They are used for respiration purpose, and we have to take 2 times a day because this is short-acting. This dilutes the bronchi. This drug causes gingival dysphagia. Dysgeusia. Albuterol present in inhalers. Certain beta-2 agonists SABA. They are short-acting. They are used for respiration purpose, and we have to take 2 times a day because they're short-acting. They will dilate the bronchi. Beta-2 antagonist, beta-2 agonist. This drug causes gingival dysgeusia. Beta-2 antagonist is a class of this albuterol. This drug causes gingival dysgeusia. In some person, it causes metabolic test. Next to the allopurinol. Decrease uric acid accumulation, anti-gut drug. Its test effect is demetabolic, it causes metabolic dysgeusia. And number 3 is leprozole. It is a sedative, it will cause hyperglycemic condition. Number is amidazole. It is used in the condition of angina pictures and it causes general gaseous. Amphotericin B. It is an antifungal condition. It causes hypoglycemia and phanatogasia. It will be metabolic test. Amphetamine. Amphetamine drug is CNS tablet. It causes gaseous condition. D. Bitter or sweet. Test. Target is bitter. If it is amphetamine is it's causes gaseous condition. D. Bitter or sweet. Am- Ampicillin. Antibiotic. It will cause hypoglycemia. Ampicillin also antibiotic. It causes hypoglycemia. Aspirin. Acetylsalicylic acid. Acidic drug. It causes dysphagia condition. D. This is sometimes given bitter taste in some people and cause hypoglycemic condition. Now, now astro, now it is the antibiotic. It causes general disgust condition. Then it's baclofen. Baclofen, a muscle relaxant used in hickle up diaphragm continuously or excitement contract and relax so hip and pucker. Stimulus excites medulla. The reason that are involved in the excitation of muscle. It causes agnosia, hypognosia, and phantagnosia. Beclomethosone, methosone, stride, beclomethosone, a stride that causes agnostic condition and hypognosia. Beclomethosone, stride that causes agnostic condition and hypognosia. Biguricide, bigonides, antidiabetic agent. It causes the demetolic and hypognosia. Antidiabetic agent. It can cause the demetolic and hypognosia. Bleomycin, anti-cancer drug. It causes agnosia, dysagnosia, and hypognosia. Bromocriptine. It is the anti-Parkinson drug, neurodegenerative disorder enhanced. And DBS, deep brain stimulant, option, electron. Last option, deep brain stimulation, electron. It is the last option. Now, seen it later as is basal ganglia is involved in movement, so this part became degenerative in this disease. If this is anti-Parkinson disease, neurodegenerative disorder, enhanced pill rolling movement, pill between thumb and finger like this movement occur, stoop posture. It's dysgosic condition and phanatogasia. DBS. Last option, electrode are placed in brain and it stimulates basal ganglia. Ganglia between the chain is electrode for up 5 years. This signal can also damage double receptor. Now, this last one is calcitriol, vitamin D derivative. It causes D-metallic. Calcitriol, vitamin D derivative. It causes D-metallic. Calcitonin, it's hormone. Does D-metallic be salty? Decrease absorption as PDH, calcium decrease in blood and C more motor and bone metabolization, strong absorption, decrease of calcium, kidney excision, increase of calcium. Bile acid contain cholesterol, calcium salt, D-metallic, Captopril, antihypertensive drug, SE inhibitor. In allergic condition, D bitter, P can be salty, metallic, or sweet. Carbamazepine, antipyretic drug, agonistic hypoglycemic pharyngitis.